There's a whole gamut. Primarily depends on where the pancreatic tumor is located. Tumors can be located in the head or the body or the tail of the pancreas, and the location dictates what type of operation. Majority of patients' tumors present in the head of the pancreas. Sometimes they obstruct the bile duct and people can become jaundiced or turn yellow. Those patients require a proximal resection or a Whipple. Those tumors in the body or the tail of the pancreas would require removal of the body and tail of the pancreas. So a lot of it depends on the type of operation, whether it's a Whipple operation or whether it's the body or the tail of the pancreas we're removing, and also on the complexity of the operation. How advanced this is, does it require any vascular, venous or arterial resection and reconstruction, and then overall general status, physical status of the patient. On average, at least at our institution, patients are at least in the hospital, for a week to 10 days, depending on the type of operation. They all go home, they recover. Usually about 2 months, they're basically back on their feet, back to their preoperative status. Yeah, so a Whipple operation is a complex cancer operation, primarily for tumors involving the head of the pancreas. It involves removing the head of the pancreas, the duodenum, which is the first part of the intestine, the bile duct, the gallbladder if it's still in place, and the first part of the small intestine. We have to remove all these specific structures because they share the same blood supply and they therefore have to be removed. In addition, we also take the lymph nodes that are in the area as well to see if there's a spread to the lymph nodes. So there's two parts of the operation. One is the resectional component where it's the most cancer-specific part of the operation and the most critically important, where we have to remove all these organs and the tumor without leaving cancer cells behind or having a negative margin. Once the tumor comes out, then we perform the second part of the operation, which is the reconstruction. And we have to reconstruct the patient's GI tract, their biliary tract or their bile duct, as well as their pancreas. Yeah, in general, so this is a big cancer operation in general. Obviously, fitter patients can recover well. We have done these operations in patients in their 80s and even some patients in their 90s. These are selected patients, but they have to be in adequate shape to tolerate such a procedure. So survival has basically been stratified according to the stage at presentation. Patients are staged according to the size of their tumor, whether there's lymph nodes, and whether it has spread outside of the pancreas to distant site or metastasized. We know that patients in general with early stage disease confined to the pancreas without lymph node involvement who can get an operation, those patients do the best. And historically that's been anywhere from 20 to 26 months on average after their initial diagnosis. Now those numbers are still not very good compared to other solid tumors. We know that patients with more advanced tumors that we call stage 3, which involve critical blood vessels and can't be removed, those survivals are significantly less than a year, and those patients whose tumors have spread to other organs, even less than that. However, these numbers have been historical, and we're seeing in the last 5 years, with the advent of these new chemotherapies, aggressive surgical techniques, that we're seeing double to tripling and even quadrupling of survival for these patients.